As scientist, surgeon, and academic leader, Professor Miner is a strong proponent of translational research, pedagogical innovation, and proactive personalized healthcare. A past provost and senior vice president for academic affairs at the Johns Hopkins University, Professor Miner serves today as Dean of the Stanford University School of Medicine. Professor Miner's visionary leadership is leveraging Stanford's strength in scientific discovery to pursue use of genetic information, big data, and international medical and scientific collaborations to transform healthcare. Please welcome Professor Lloyd Miner.
Thank you. Well, thank you very much, and good morning. It's wonderful to be here, back here at Rambam today, and to be able to share some thoughts and ideas with you. I just wanted to explain a little bit about how our collaboration between Stanford and Rambam began. I was introduced about a year and a half, 2 years ago to Professor Bayar by a mutual friend and colleague, Bill Brody, who's a former president of Johns Hopkins University, where both Professor Bayar and I have been in the past. And we met when I visited Israel in August of 2017, and it really became clear to, I think, both of us that we needed to try to do something together that would pull our two institutions together because we share so many common goals and aspirations. And in fact, we already had faculty collaborations going on even before Rafi and I discussed sort of the next chapter in cardiovascular medicine and other areas. And then in March of 2018, we hosted a delegation from Rambam at Stanford. And then in January of this year, I had the privilege of coming over with about 8 of my colleagues on the faculty at Stanford for a symposium here at Rambam. And I want to say also that it's wonderful to welcome Professor Halberthal into his new role, and I know that our collaboration is going to continue to thrive working with Mickey and all of you moving forward. So I wanted to sort of introduce why I think collaboration is important and some of the areas in which we're pursuing those collaborations at Stanford. You know, one of the things that's so exciting about being in biomedicine today is that I think the 21st century will be known as the century of biomedicine because we see, and already this morning in the speakers and in the TED Talks, we've heard so many areas of convergence between other scientific disciplines, other technologies, and healthcare. And I think that's only going to increase moving forward. We each year do a health trends report as a part of Stanford Medicine. Our second health trends report came out in 2018. And I'll just read a quote from that report. The continued challenge for the once cloistered field of medicine, you know, there was a time in which medicine seemed different from everything else, will be determining. And that is how to collaborate in ways that actually improve the outcomes for people. And I think that's the great challenge, both the challenge and the opportunity for us moving forward. So today we see areas of chemistry and engineering and very basic biology coming to bear on problems of health and healthcare delivery. And so there's never really been a more exciting time, I think, to be in our fields. And increasingly, although the role of the individual investigator is still extremely important, increasingly the most important advances are going to come from collaborations among investigators, in many cases from different fields and different disciplines. And so what we want to do in leadership is make sure that we're breaking down any barriers that might exist for those collaborations, both within our institutions and also between our institutions. Now, I want to talk about a couple of things that we've tried to do at Stanford in order to encourage collaborations. collaborations both within Stanford and increasingly collaborations with industry as well. So I established in our dean's office an office and an associate dean position for industry and industry relations and digital health, because there were so many, just within our region, there were so many early stage and also large tech firms that were interested in pursuing areas related to health, and they wanted to explore how they could collaborate with us. So we have an office to explore those and help to facilitate those interactions. Just as I know you have at Rambam, and indeed you have your own innovation office and accelerator located near to the campus that I had the privilege of visiting back in January. And also we are providing and will continue to provide seed funding, both for collaborations among faculty at Stanford, but also funding opportunities that will enable faculty to collaborate outside of Stanford. And one of the things that we've been working on both with Mickey and Rafi in terms of the Stanford-Rambam collaboration is the philanthropic support that will enable Rambam investigators and Stanford investigators to be able to do projects jointly together. Today, all of the large tech firms are seeing health and health care as being the next frontier for them. If you think about it, the revolution in technology since 2007, when the iPhone was first introduced, the revolution in consumer-facing technology has transformed pretty much every aspect of our economies and of our societies, with the exception of health and health care. Today, the way we order goods and services is radically different than the way it was a decade ago. The way we perform financial transactions. Most aspects of our day-to-day lives have been changed dramatically by technology. Now, you can argue whether or not that's good or bad, but it certainly is a feature. But the fact is that health and health care have been relatively unaffected by technology. And I think the opportunity moving forward is to leverage what's good about technology, namely technology being an enabler for each of us to learn more about the world around us, to have information at our fingertips, to communicate more freely and openly with others. The opportunity is to leverage that to the benefit of health and healthcare delivery. So what do we need to do in order to make that happen? Well, increasingly what we need to do is to break down the barriers and the silos that exist for data. The limitation on the application of disciplines like deep learning and artificial intelligence, the limitation of applying those very powerful techniques to health and healthcare is not a limitation based upon algorithms or analytics. Rather, it's a limitation based upon access to data. And when we're able to break down the barriers to the access to data, then we see dramatic advances. And I think the one that we can point to the most, and it's going on here in Israel, in a number of different early stage companies and work going on at institutions in Israel. One company that comes to mind is Zebra. What we're seeing both in Israel, the United States, in diagnostic imaging is the enormous additive advantage of machine learning, artificial intelligence as applied to helping in the interpretation of radiology images. Now, there are a few advantages for radiology. One is that the data comes in a digital format. You know, we did away with X-ray films a long time ago, so the data is already digital. And the second advantage is that it's relatively easy to de-identify most radiological studies and make them to where that you're not in any way revealing a patient's identity when you allow the study to be used in a large-scale analysis. And those two advantages have helped entrepreneurs and faculty members to really pursue digital techniques of analysis like deep learning to improve how we interpret and understand the studies. Also, we're seeing, I think, the early stages of how consumer-facing devices can help each of us learn more about our health, and also as healthcare providers, in the not too distant future, I hope help us be able to engage with our patients in ways about their health that we haven't been able to do in the past. We recently completed a clinical study, a clinical trial with Apple, using the Apple Watch to detect the most common arrhythmia, which is atrial fibrillation. You know, we don't actually know today what the true incidence of AFib is. And the reason we don't know it is that it can be an intermittent disorder. And if we had a way in the background to monitor for AFib and then to accurately alert people if it's detected, then that could add a lot to human health. You know, to this day, one of the most common ways that AFib is diagnosed is when it presents with a secondary complication like a stroke. It would be best if we could detect it long before that occurs. We collaborated with Apple to do this clinical trial. It was entirely a virtual trial. The people enrolled in it never encountered a bricks and mortar facility. They downloaded the app from the iTunes store, and then they gave consent. It was an IRB-approved study. They gave consent, and then the watch, along with their smartphone, their iPhone, monitored their heart rate and rhythm and also monitored their activity level. And if their heart rate went up and they were exercising, they were moving, then that's what your heart rate should do. But if their heart rate went up and they were sedentary and it fluctuated between, say, a baseline level in the 60s or 70s and, say, the 120s to 140s, if it fluctuated without any relationship to physical activity, then the algorithm would trigger an alert. And there were a variety of other parameters that were looked at as well. That alert then would enable a patient to, a participant to connect to a telehealth company called American Well, and the meaning of the alert would then be explained in their interaction with the healthcare provider. They would then be given the option of receiving a patch EKG that they could wear for 10 days, mail it back in, and then we would compare what the watch was saying and what the patch EKG was saying with regard to AFib. Several interesting findings from that study. That study was presented about a little over a month ago at the American Heart Association meetings in the US. One finding is that we had been very concerned that if the watch triggered a lot of spurious alerts, then no one would use it, and we shouldn't be using it if it's raising a flag unnecessarily. But in fact, it didn't. Only 0.5% of participants in the study actually ever got an alert. And when those participants then wore a patch EKG, then the watch was about 84% accurate in detecting AFib. In other words, it was also confirmed based upon the EKG readings. So I think an early study, but a powerful indication that consumer wearables like the Apple Watch are going to play an increasingly important role in monitoring health, and in ways that should be able, all of us, to have a better indication of our ongoing health status in ways we haven't had in the past. We also work with Verily, which is formerly known as Google Life Sciences, on this longitudinal cohort study, 10,000 people. Everything you and I can imagine about the health of these 10,000 people will be measured, and then they'll be tracked longitudinally. So this is like the Framingham study, a study that began, I think, about 60 years ago, that's taught us so much about the risk factors for cardiovascular disease. This is like the Framingham study to a much higher power, in that we're getting a lot more information. And from that information and the tracking of their health, we should have a lot better understanding in the future about the determinants of disease. Now, 10,000 people is still relatively small, but in parallel with the baseline study, the U.S. National Institutes of Health launched a study called All of Us that seeks to enroll 1 million people. Now, it won't be a longitudinal study, but it will measure a number of things importantly at one point in time, including some genomic tests that should also, when coupled with baseline and other studies, give us a lot better understanding of the predisposing factors of disease. You know, our strategic theme in Stanford Medicine we describe as precision health, not precision medicine, but health, because we want to focus on keeping people healthy and not just treating them when they get sick. And the way to do that is to predict, prevent, and cure disease precisely, but in that order, with a lot more emphasis on prediction and prevention than traditionally we've had in academic medicine in the past. In addition to our work with Rambam, we have some other collaborations, and I wanted to mention just one today, and that's a collaboration with Intermountain Healthcare. Intermountain Healthcare is a large integrated healthcare delivery system based primarily in the state of Utah. It's a fully integrated system, and it's been appropriately recognized and lauded for its focus on quality. So we now have joint training programs in areas related to quality. We have some Intermountain faculty that are on our faculty, particularly in areas of medicine, cardiology, and quality improvement. And we're learning together how to best advance the science of quality and how to introduce quality into the standard training programs for all physicians moving forward. Finally, we're also collaborating with several nonprofit and philanthropic initiatives. The one I want to mention today is called the Chan Zuckerberg BioHub. This was launched by Mark Zuckerberg and Priscilla Chan in order to promote fundamental discovery. I think they very appropriately recognized that every advance in health and in medicine can be traced back to some fundamental advance in science and technology. So the Chan Zuckerberg BioHub provides $600 million to the 3 Bay Area institutions, University of California, San Francisco, University of California, Berkeley, and Stanford, in order to promote fundamental discovery research and also the development of new technologies that improve biomedical discovery. And this bringing together of the 3 institutions already has kindled new collaborations among faculty and is advancing fundamental science in some really exciting ways. So I think there are a few keys to productive collaborations. I'm just mentioning 4 of them here. First is to align early on of what the goals, the process, and the timeline will be for collaboration. In order for collaborations to work, both sides, all sides, have to see the water rising. Everyone has to benefit from a collaboration, or ultimately it won't work. It's also important to set the expectations early. It's important that we identify things that lead to tangible deliverables up front, but it can't just be a tactical collaboration if it's going to last and be meaningful. There also have to be aspirational goals. And it's a combination of short-term goals with a high probability of success and larger scale aspirational goals that I think underlie the most successful collaborations. And that's certainly what we're trying to build in our collaboration between Rambam and Stanford. It's important to define the parameters early, how the funding's going to be provided, how we're going to engage faculty from both institutions. You know, those of us who are leaders at Rambam, leaders at Stanford, we can have a great idea, but if our faculty don't buy it or don't buy into it as being a great idea, it's not going to go anywhere. So in a sense, when we have a great idea, or we think we have a great idea, it really becomes a great idea when others embrace it. And over time, it wasn't our idea. It was the faculty's idea. And that's what we seek to build in these collaborations as well. And finally, particularly for those of us at academic centers like Rambam and Stanford Medicine, we always want to keep the patient at the center of everything we do. And it's so inspiring today to see that that's not as difficult to do as it has been in the past. Even the most fundamental discovery-based research today, which is magnificent, that's what we need, even the most fundamental discovery-based today, in every case has some human relationship. You know, we have 7 Nobel laureates on the faculty of the Stanford School of Medicine today. Every one of them has done and is doing projects that have some direct human correlate, even though their Nobel Prizes are in work that's very fundamental biological discovery. It's so much more tractable today to bring together the health focus and the discovery focus. It's much easier, if you will, to do that today than it was a few decades ago. And promoting translational research is really a matter of promoting the discussion and the dialogue that gets our discovery-based scientists working side by side with the physicians and the faculty that are delivering care to our patients every day. Thank you very much. I look forward to our continued interactions.